I'm Dr. Biren Nadkarni. I'm a practicing consultant orthopedic and joint replacement surgeon. I'm based in South Delhi, practicing in Hauskas, and I consult at Sitaram Bhartiya Hospital and Cygnus Orthocare Hospital. Arthritis is a major scourge which we are facing in these times. And arthritis can be broadly divided into osteoarthritis and rheumatoid arthritis. Although the main problem we are facing now is osteoarthritis, which is arthritis of aging. Though it is difficult to say what exactly is causing this problem, but we can call it a wear and tear arthritis, and most of the times it is happening because of previous injuries. It is associated with female sex, and then of course people who are over aggressive with their knees, had previous injuries, they are the ones who actually are more prone to this problem. Weight and obesity of course adds to the same problem. And arthritis basically belongs to a set of problems which is a hidden problem and we are not able to deal with it properly. Initially most of the people just wish it away thinking that it is just a problem of aging, like the graying of hair. But it's something more and it requires much more dedication and effort from the side of the patient as well as the treating doctor. Arthritis management is a big issue, and most of the times we are starting these patients on medical management, a lot of physiotherapy management, and sometimes if friends they don't respond to all this, we subject them to intra-articular injections, which could be a cortisone injection, especially for a lot of inflamed knees, or it could be an injection for boosting the cartilage supplement like Synvisc or hyaluronidase injections. All these basically work for a period of not more than 6 months to a year. And the dictum is if you have tried and given enough trial to all the basic modalities of management, be it the medicines, the physiotherapy, the supports, and once we find that the people are not responding to these modalities, we then offer them a surgery which could be a joint replacement surgery or a osteotomy if probably a younger patient is there. And sometimes, very few times, we tell them to go for a arthroscopic procedure, especially if they have intra-articular mechanical symptoms like locking of the knee or some loose bodies which is troubling them. Knee replacement is a very satisfying surgery. The results of this are indeed very satisfying, and if you talk in terms of statistics, the 15-year revision rate, 15-year satisfaction rate is almost about 90 to 95%. But sometimes what we see on the X-ray of a beautiful result does not translate the same in terms of the patient's expectations. And we see that a lot of this has to do with the patients not coming to us at the right time for the surgery. Most of the times the surgery has been prescribed for these patients who have taken enough medications and they have not responded to that, they have done enough weight management and other things, and they still are very painful. But people tend to linger on with their symptoms many times, coming to us at a very later stage. And this is a problem we face in this country much more than people actually in West do, because surgery for knees is considered as a big no for most of the patients, and to convince them that it can actually change their life takes a lot from the medical fraternity. Basically, knee replacements require some kind of precautions to be taken after the surgery. We expect our patients not to do things like squatting, like sitting cross-legged, and try to lose weight if they have not been able to do before. Because after all, knee replacement is a mechanical part which has been installed in the knee, and it takes a lot of weight. And if you lose some weight, you are putting less pressure on the joint. And this is not like the natural joint which has lasted for about 50, 55, 60 years. It has a finite life, and finite life could be between 15 to 20 years, depending on the type of implant you have used. But grossly, all these implants are now are doing very well, and our registries, the joint registries, are great. They're telling us that these joints are